Today we're looking at issues papers, specifically some of the issues papers that were published at the end of last year. My name is Troy Hester, and I work for Family Advocacy in the Disability Royal Commission advocacy space. I stand today on Darug country. Here at Family Advocacy, we acknowledge the traditional custodians of the land on which all our officers stand, and we pay our respects to elders past, present and emerging. We acknowledge the sorrow of the stolen generations and the impacts of colonisation on Aboriginal and Torres Strait Islander peoples. And we also recognise the resilience, strength and pride of the Aboriginal and Torres Strait Islander communities. I want to extend my respect to any of you out there who are Aboriginal or Torres Strait Islander and welcome everyone here today. And my hope is that this webinar is going to be a good resource for all of you. I'm going to start off by talking briefly about Family Advocacy. Family Advocacy is a New South Wales-wide independent disability advocacy organisation, and we work with families to undertake advocacy with and on behalf of their family member with disability. Family Advocacy was founded by families who were concerned about the rights and interests of their family member with disability. And we continue to be governed and staffed by families and their allies. We provide general advocacy advice and support. We encourage and support people to be good advocates with and for people in their family who have disability. And my role here with Family Advocacy is actually supporting anybody, whether that's a person with disability, a family member, a person who's got a family member with disability, or somebody who works with somebody with disability, to connect with and engage with the Disability Royal Commission. That's what my role here is. I'm going to start off before I do anything else with a content warning. The Disability Royal Commission is obviously focused on issues of abuse, violence, exploitation and neglect, and we'll be talking generally about those topics today. So please, if you feel the need, stop the webinar, take a break if you need to. The webinar is recorded, you can come back to it. And there is free emotional support and counselling available to people through Blue Knot. And this is for anyone affected as they think about or talk to the Disability Royal Commission. Blue Knot's hotline is 1-800-421-468. And they're available 7 days a week. So if you feel the need to contact somebody, they're a great support. And I've contacted them a couple of times myself because these are very strong issues. So just some housekeeping. This is a Zoom call. It's not another kind of webinar. So your video and your audio is on and goes out to everyone. Please mute your microphone and decide whether or not to keep your video on. Make sure you grab a pen and paper, have a pen and paper with you so that you can take notes. This is because we're going to cover a lot of different content. Some of it will be relevant to you, some of it may not be relevant to you. But if you've got a pen there, you can make a note of things. And if you're watching this as a recording, you can record the time that I talk about something, and so you can come back to it later. We will have questions today, so if you can use the chat function to type up any questions, there will be hopefully there will be some time at the end for some live questions, but if you've put your question in the chat function, it means that even if we don't get to it today, we can follow it up in another way. This webinar, but not the chat, will be published on our website after we finish today. So you can watch it again and you can share the link with others. Your video, your face will not be seen unless you're actually speaking and asking your question. Oops, sorry. We'll also have a feedback form. We like to keep improving these webinars. There's a link to the feedback form in the chat, so you can have a look at it from now if you'd like, and we'll also email you a link after this event. Okay, so the Disability Royal Commission's been going for over a year now, and it's still got a year to run. and maybe perhaps even longer. The Disability Royal Commission has a number of different elements to it. One of them is submissions. That's where people write into the Disability Royal Commission or send something into the Royal Commission sharing their own experience. The Disability Royal Commission has issues papers, which is what we're focusing on today, and they highlight different issues. Community events are events that the Disability Royal Commission runs and has run, although right now they're still on hold. Hopefully they'll be coming, and we'll be seeing more of them as the year progresses. There are public hearings that the Disability Royal Commission does, and they are formal and public investigations. They publish those on the website, and you can watch them as they come up. And they are the time where the Commission very publicly asks questions, both of people's experiences, but also of people who have responsibilities for certain organisations, for people who do research, and to find out what needs to change, what's not working, and ways that things can be done better. And then the other thing that the Disability Royal Commission does is private sessions, and they are a way of the Commission hearing a submission, and that's where a person meets face-to-face with the Commissioner to tell their story, and that's done mostly for privacy reasons. Today we're going to focus on issues papers. All the issues papers that have been published, there's been 12 so far, are published on the Disability Royal Commission's website. You can see a section of it here. This is the link. And if you go on the Disability Royal Commission's website and you scroll across to this tab, Document Library, and then you'll need to choose the document type because there's lots of documents, and then you'll be able to find the issues papers. We'll be looking at some of the more recent ones today. If you have trouble finding an issues paper and you'd really like a copy, you can also contact me, and my number is here, and my email address is here. And the issues papers are published both in Word and as PDF, and there's also an easy English version available. Last year, just towards the end of last year, when everyone else was busy with many other things, the Disability Royal Commission published 3 issues papers. One of them was on safeguards and quality, including NDIS practices. The second was on violence and abuse of people with disability at home. And the third one was on promoting inclusion, or what is needed for a more inclusive society. The plan was to look at all 3 of these issues papers. Having done the work on them, they're just too densely packed to get through 3 of them in the time we've got available. So we've decided that we're going to put the promoting inclusion one to one side, and we'll pick that up again soon and look at and have another webinar focused just on that issues paper. So what is an issues paper and why respond to one? Now, I have learned stuff. I've been working in this role for over a year now, and I've learned stuff about issues papers just by preparing for this. So I'm going to share that with you now. The first thing is no surprise to you. Issues papers are focused on specific topics. But the thing about issues papers is that they come from the research arm of the Disability Royal Commission. So the Disability Royal Commission is looking at many different things. They're looking at violence and abuse, neglect and exploitation of anybody with any kind of disability across their lifespan, and in every context and setting. I've just realized that phone's going. There you go. Across every context and setting. And the issues paper focuses on just thin slices of it and looks at specific topics. So the issues papers are there for research, and they're there to hear your voice. So as they do research, as the Disability Royal Commission decides what it's going to investigate, and and how to unpack some of these topics, it actually looks to members of the public. It actually looks to you as somebody who's got experience in these contexts and settings, and asks for your voice. It asks for your experienced opinion on what goes on in these settings. So responding to issues papers is different from making a submission. And I'll just go into that a little bit more now. So you can think of submissions and responding to an issues papers as two different approaches based on the same experience. So for example, if I've got an experience where my daughter suffered neglect at school, I can put a submission to the Disability Royal Commission describing what happened there. I talk about what happened, what was the impact on my daughter, what was the impact on us as a family, what was the impact on the school, and in sharing that experience, I will be, a lot of different topics is going to come up. A lot of issues may be raised. I might be talking about inadequate teacher supervision. I might be talking about a plan that's not done or wasn't followed through, even though it was written there. I might be talk about untrained staff, lack of complaints policy, poor communication between the school and our family, lack of follow-up by the school, maybe a Department of Education runaround. I might be talking about no accountability. I'm focused on what's happened to my daughter, what's happened to our family in a particular context or setting. I can use that same experience to respond to an issues paper. Then my focus might be that the New South Wales Education Department has certain responsibilities towards safeguarding students and to do with quality. And in that, I might focus on the lack of clear policy of the department, the training of departmental staff, accountability structures, responsive timeframes, communication, transparency principles. I'm focusing then on what needs to change at the New South Wales Education Department in order to have quality safeguards for my daughter at school. And I'm doing that based on what's happened and what I've seen and what my experience is and what my daughter's experience is, but my focus is different. Now, I can put both of those into the Disability Royal Commission. One submission, one response to issues papers. And they don't detract from one another. In fact, they both build on each other. And so that's what's happening when we're talking about responding to an issues paper. There might be something entirely different. Again, somebody in a group home or in an aged care facility who can't access their money. That's an experience where they can be talking about what that was and what the impact of that was, or they could be using that experience to be talking about the kind of measures and policies that are happening in one of those closed settings. It's two different perspectives on the one issue and the one experience. And that one experience may actually give you a response to a number of different issues papers, just with a different focus, with a different focus. So with issues papers, every issues paper has a closing date. And because it's a research document, because they're asking for your input into their research, then the closing date is really important to them. What you'll find is that for every public hearing, there was an earlier issues paper. And the request for responses to the issues paper then goes into the investigation and planning for the public hearing. So there's a great opportunity for you to influence what happens at a public hearing by getting in to a response paper, getting a response into an issues paper before the deadline. So closing dates are really helpful for the Disability Royal Commission because then they collect all that extra input to their research for their investigation. A closing date is also helpful to you because rather than focusing on a complex experience, your story, you're just taking out one slice of it and you're saying, okay, I'm going to focus on what the Education Department's response was to what happened to my daughter as part of quality and safeguards or something similar to that. And then you've got a distinct focus which has a closing date. Now, the thing about closing dates is that you can still put in a response to an issues paper after the closing date. And you can put in a submission anytime at all. But by getting it in by that deadline, you will have a greater impact on the direction of the Disability Royal Commission's work. And so that's why that deadline is there. And it's a real privileged opportunity just to be able to say, okay, when you consider this particular topic, I want you to hear from experience what that's like and why this is an issue or why there's a gap or why it's working well. So with these three issues papers we're focusing on today, the Safeguards and Quality Issues paper, the deadline is the 1st of February, so it's only a couple of weeks away. The Violence and Abuse of People with Disability at Home, the closing date is the 26th of February, and the closing date for the issues paper on promoting inclusion is the 2nd of April, which is Easter. So that's the other reason we've chosen to put promoting inclusion aside for today, and we'll be focusing on that again soon. Okay, so how do you respond to an issues paper? I'll let you in on a secret. I got the answer to this by ringing the Disability Royal Commission's hotline. You can ring them about anything, any questions you have about the Disability Royal Commission, feel free to ring their hotline. The most important thing in your response to an issues paper is your voice of experience. You get to see things that nobody else does. You get to know from experience things that a commissioner at the Royal Commission doesn't know. You get an inside view that a researcher doesn't get. Your voice of experience is what you use to respond to an issues paper. The Commission wants to know what's really going on, not what people say is going on, but what really goes on with a particular issue. What's working? What works in practice? What works here? What works here? What used to work here but is no longer working here? Or what do you know works somewhere else? So if you've got an example from another state, from another country, from another organization that works in that organization that doesn't work in this organization, the Commission wants to know what's working. The Commission wants to know what doesn't work. Where are the gaps in the law? Where are the gaps in policy? Where are the gaps in services? Where are the gaps in accountability? And you can also say why something, you can also explain why something doesn't work for you or for someone like you. It might be working for 90% of people with disability, but it's not working for somebody in your situation, somebody in your area of the state, somebody in your organization, somebody who has the complexity that you have to work with. So you can explain why it doesn't work for you and what changes might need to be made. In all of this, build the case for the changes that need to happen. The Commission is there to help to make change happen. So when you write a response to an issues paper, make the case for what needs to change and why it needs to change. Okay, so that's the general summary on issues papers. If you've got a question, jot it down, and we'll come back to any questions later. I'm now going to look in detail at one of the issues papers. If you're on a small screen, I'm sorry, this is going to be very hard to read. I encourage you to go back and look at it on a larger screen. Okay, so let me just find the first of the issues paper here. Okay. And, okay. Oh. Right, I'm going to go through the Safeguards and Quality Issues papers, which is the one that came out early November and is due, the closing date is the 1st of February. All of these issues papers have similar features. They all start with an introduction. They all start with a content warning and then an introduction. This one's on safeguards and quality services. Safeguards and quality services are key areas of inquiry for the Royal Commission. The purpose of this paper is to invite information and discussion from people with disability to better understand how safeguards and quality services may prevent and reduce violence, abuse, neglect and exploitation, and improve the responses where it does occur. The Commission wants to hear about gaps and in ways in which safeguards could be improved, and they're interested in the interaction between people with disability and services, such as education, health, justice, transport and accommodation, and with the NDIS, the National Disability Insurance Scheme. This is not just about the National Disability Insurance Scheme's Quality and Safeguards Commission. It's about any safeguards that are out there, and we'll go through some of this as well. It is about the NDIS, but it's not just about the NDIS. I'm scrolling. Every issues paper has a series of definitions to help you to understand what the Commission is thinking and what the Commission's approach is. If you think that there is something that has been missed in the definitions, then write to the Commission, tell them all about it. Safeguards can be defined as actions designed to protect people, to be safe from the risk of harm, abuse and neglect, and they can be both informal and formal. So informal safeguards are things like self-advocacy and maybe a network of trusted relationships. Formal safeguards, there's lots of different things. I'm going to cover them both as we go through a bit more. Every issues papers talks about the approach of the Commission. The Disability Royal Commission is a human rights-based approach which draws heavily on the UN Convention of the Rights of People with Disability, or the CRPD. And all of the issues papers that you read, you'll find where it specifically talks about how that's relevant on this particular issue. So here, because Australia has signed up to this convention, the CRPD, the CRPD requires state parties, like Australia, to take legislative, administrative, social, education and other measures to protect people and to provide for effective monitoring by independent bodies. It also requires that legislation and policies should enable these incidents to be identified, investigated, and where appropriate, prosecuted. So that's the responsibility that Australia has in order to adhere to the United Nations Convention on the Rights of People with Disability. The Disability Royal Commission's terms of reference require that they look at the multi-layered experiences of people who have not just disability, but also might be of different ages, different sex, different gender identity, different sexual orientation and race, how having a disability interacts with being somebody from, of First Nations with disability, or somebody from a culturally and linguistically diverse background with disability. And it recognizes that it may be even more difficult for people when they identify with more than one marginalized group. And you'll see that right across the issues papers. It has a human rights-based approach. It also has a life course approach. So the Disability Royal Commission is interested in how things change, how things are different for children, how things are different while kids are at school, how things are different for people as they leave school and start in the workforce or move on to university or other things, and into aging. Every different time of life is relevant to the Disability Royal Commission, and they're interested in hearing from different times of life. In terms of informal safeguarding, here are some examples. Building individuals' skills, independence and confidence, supporting people from specific cultural groups, enabling self-advocacy, communication supports and informal advocacy, building a network of trusted individuals, additional support for people with communication barriers or high support needs. When we're talking about people being safe, it's not just their interaction with systems and services. Just going to the top here, people with disability live complex and multifaceted lives that go beyond their interaction with systems and services. Approaching to safeguards needs to reflect this. So if you've got input on any of these things, including self-advocacy and other advocacy, including additional support, including networks, then these are things to bring in your response. And then formal safeguarding is about laws, policies and practices, and the policies and practices around NDIS. Not just the ones around NDIS, but also in organisations, in governments, any of these things. It includes criminal law. It includes policies and programs addressed at domestic and family violence. And other safeguards are independent oversight of group homes or other closed settings. The NDIS quality and safeguarding framework is there to ensure high quality services and safe environments. There are some different elements here, and the Commission is interested in knowing whether this framework is actually doing what it's aiming to do and keeping people safe and providing quality services. If you have experience here, if you can give an experienced voice, the Commission is interested in hearing from you. Not only the NDIS, but even, for example, the Australian Commission on Safety and Quality in Healthcare. Any body, any set of policies, procedures that's there to keep people safe, the Commission wants to know, is it working? If it's working, tell them. If it's not working, tell them. If it's working but there's these gaps, then that would be your response. There's a lot of different things here. Some of you will be able to comment on certain things. Others will be able to comment on other things. Then here again, it goes into lots of detail. There are different ways these measures might be there. Some measures are there to change negative culture and strengthen quality and safeguards. That might be public awareness campaigns. It might be how an organisation builds capacity for high quality services. It might be about data collection. Maybe there's not enough data collection happening in your area. Preventative measures are there to ensure high quality services are there and minimise the risk. Screening workers, practice standards, independent accreditation, organisational policies and procedures. So some of those organisational policies and procedures might just be around discrimination or about what happens in the workplace. Accountability of decision-making arrangements like guardianship. Regular reviews, safeguarding mechanisms. I'm sorry, there's so much here, I'm just going over it quickly. You'll need to go through and unpack it. And then the corrective measures are there to use to respond. Complaint processes is a big one. If you don't have an adequate complaint process and response process, then you're not going to have quality service and you're not going to have a safe service. So in whatever field, in whatever setting you're familiar with, whatever you've got the experience in, the Commission would like to hear your experienced voice. Okay. Very brief overview of many different things. Just with questions, every issues paper has a series of questions. The questions are there as a guide. They're there to help you to make a response. They actually say, please answer as many of these questions as you wish. You can answer just one question, or you don't need to answer any of them. When you're giving a response, you can choose different areas of life. For example, education, healthcare, criminal justice, home. You might consider a different life stage, whether it's at school or transitioning from school to work or retiring. I'm going to go through these questions very quickly. Again, they're there as a guide. Question 1. What are the best ways to safeguard people when they use services? What are the best ways to safeguard people in other areas of their lives? How can quality services help to prevent violence, abuse, neglect, and exploitation of people with disability? And how do you know a quality service? What are the features of a quality service? How could safeguarding laws, practices, and policy frameworks be improved, including the NDIS Quality and Safeguarding Framework? We are particularly interested in Australian and international examples of good practice. Maybe it's something that doesn't work in New South Wales, but there's something better in Queensland or in Victoria. Maybe it's something that used to exist in New South Wales but doesn't exist anymore. If you've got an experience of good practice, that's what the Commission wants to hear about. If you've got an experience, if you know of something that works well in the UK or something that's happening in Sweden or somewhere else, and it's something that's working, the Commission wants to hear about it. If they're looking to make changes, what are they changing to? So if you can give an example of a good practice, that's really valuable to the Commission. What can be done to uphold independence, choice, and control for people with disability? Where is somebody not being given choice? Where is somebody not able to, where is there a barrier to somebody's independence? And what needs to change so that these things, so that people have independence, choice, and control? What challenges are presented by differing safeguarding approaches used across Australian jurisdictions and across different types of services? This actually came up in medical restraints when they were talking about the use of chemical restraints for people with disability. They were talking about Queensland, and they talked about the different national standards and Queensland standards. And the Commission actually did spend some time investigating what was the problem having in national services and state services. I know I was talking to somebody who was talking about financial abuse in a group home, and it's very interesting when you ring up a New South Wales ombudsman about that. They go, "Oh, so is the group home administered by somebody, a service that's NDIS registered?" Yes. "Oh, I'm sorry, you'll need to go to the national reporting line rather than the New South Wales reporting line." So those kinds of examples, the Commission needs to hear from people who know what the problems are and knows where the potential gaps are, or knows where they're working well. Question 6. What role does or should independent monitoring and oversight play? Should the NDIS Quality and Safeguards Commission be taking a more active role in ensuring service providers are adhering to appropriate standards, particularly during the pandemic crisis? What safeguards are required for people who do not have informal supports like families or people they can turn to? What about people who have communication barriers or people with high support needs? How can informal safeguards be strengthened? What are the ways people can develop their personal capacity to safeguard their own lives at different stages of their lives and as circumstances change? Are there systems in place to support this capacity development? What barriers do people with disability face when making a complaint, and what will help address these barriers? We are interested in hearing about complaints processes across a range of services and areas of life. You've probably got experience in dealing with complaint services in a number of different areas. Maybe some of them work better than others. Maybe some organizations are better at responding than others. That's a great time where you can talk about what works, what doesn't work, what's a good practice, what's not so good practice. If you just want to answer one of these questions, that's really valuable to the Commission, and it's a way that you can influence the Royal Commission. How can safeguards and complaints processes be improved to better meet people who are more marginalised? And it gives an example of different people there, and the ways that different the complexities that can be true for different people. And the last question is something I really want to focus on. What else should we know? The Commission is interested in what you think they should know. The Commission is not trying to dictate for you what questions that you need to answer. It wants to know what you know. It wants to know what you think is important. It wants to know from experience what it should be investigating and what it needs to change. So, as I say, you don't need to answer all of the questions. You don't need to answer any of the questions. You could just pick one question. It doesn't need to be long. You can respond by email, by letter, by phone. You can make an audio recording, a video recording. You can make your response in any language. And we encourage responses by the 1st of February 2021. Responses will also be accepted after this date. If you need support, then you can talk to Blue Knot for emotional support. You can talk to the legal services, Your Story Legal Service for legal advice, and you can talk to me here at Family Advocacy or one of the other organisations under the National Disability Advocacy Program. All right, I'm going to stop scrolling through that paper and come back to another paper. Okay. So as you can see, there's a lot there, and there's a lot of complexity, and the Commission is interested in your voice in any of those things. Let me just jump back to here again. Where's my PowerPoint? Okay. The second of the issues papers, and I'm not, as you can see, I'm not going to spend as much time on this one, is on violence and abuse of people with disability at home. This is really interesting. I thought when I picked it up, I already knew what it was going to say. This paper is the Commission asking questions and being curious about what is the best way to approach this very sensitive and private and very complex issue. And it's looking at different questions, particularly if home is where I live, then how can I be safe at home? So home might not be your family home. Home might be the group home you live in. It might be shared accommodation. It might be a closed environment. It might be foster care. Whatever home is for you, how can you be safe at home? And that's what the topic is of this issues paper. Again, it's looking at all forms of violence and abuse. It's looking at physical violence, neglect, emotional, psychological abuse, sexual abuse, financial abuse, exploitation, restraint, coercive control, where you're no longer free, where you're intimidated, where you're threatened. All of this kind of violence and abuse is what the paper is looking at. And the other question that the paper is looking at is, so violence and abuse can be at the hands of an intimate partner who may or may not have a disability themselves, other family members, professionals who come into your home, housemates, co-residents. All of these people are capable of being a perpetrator of violence and abuse. How does that work? How is the experience different? How does the law treat them differently? How do support services treat these situations differently? And should they be treated differently or in a similar way? These are questions that all come out of this issues paper. So it's quite a complex issues paper. I'm just going to run through it even quicker than I did the last one. I realize that I'm going quickly. Okay, so violence and abuse can happen in all types of homes and accommodation, and it gives a broad definition of what home is here. And it's asking, again, it's asking for people to speak from their experience so that when they come to doing research, they're not just focusing on one thing, but they're looking at as broadly as possible. It might be different in an urban, regional, remote, or very remote area. And again, the Commission is also inviting examples of good practice for preventing violence and also responding to violence, abuse, and abuse in the home. Again, as I said, all forms of violence and abuse, often referred to as domestic and family violence, all perpetrators of violence and abuse. They're also looking specifically at people who are more vulnerable, and there's a focus on not only women with disability, noting the intersection of discrimination based on gender and disability, but also the multi-layered effects. You know, people of different ages experience violence and abuse differently and can respond in different ways. Different sexes, different gender identities, First Nations people, culturally and linguistically diverse people, people from the LGBTIQ plus community, all may experience violence and abuse in different ways, and all may have different mechanisms where they can actually report it and have it responded to. So the Commission is interested in hearing all of that. Again, it focuses on the human rights approach that it takes, and there's a few more articles from the Convention on the Rights of People with Disability. Life course with a specific focus on transitions. So as people in transition are at greater risk of violence and abuse, whether that's because they've become homeless, whether the relationship's broken down, whether they've become pregnant, become a parent. And sometimes violence and abuse in one area can affect other times in their life as well. And it can also have an effect on how they can go to the justice system and how they are treated by the justice system. So all of these complexities is what the Commission is interested in getting experienced voices telling them about. There have been calls to improve collection and reporting of domestic and family violence data. People with disability may be subject to different forms of violence and abuse, particularly around personal care. If you're reliant on somebody to help you with food or with medication or with personal care like toileting and showering, then you are more open to different kinds of violence and abuse than other people. Sometimes the violence and abuse can be about not being able to communicate with family, not being able to communicate with friends, not being able to have independence or even choice. So all of these matters are matters that the Commission is interested in hearing your experienced voice on. People with disability are also more likely to be at risk of homelessness. People on low income or lack of employment can also be at greater risk. So even the complexity between being unemployed and having disability and the risks that you both put under and what support services you can access. Again, the Commission focuses on specific groups just because of the complexity. Women and girls with disability, First Nation people with disability, culturally and linguistically diverse people, children, older people, and other communities, at-risk communities as well. And then the question of, is all violence and abuse in the home domestic violence? One of the issues the Royal Commission is exploring is whether all violence and abuse that occurs in places where people with disability live should be considered under domestic and family violence law and policy. Do you have an opinion? Do you think it should? Do you think it shouldn't? Can you unpick some of the complexities of why or why not it shouldn't? These are ways that you can contribute to the investigation by the Disability Royal Commission. And then barriers to getting help. barriers might be the fear of punishment from family or the community in which you live, which might be your cultural community, it might be your local community, it might be your community of disability. And there is also special fears around losing supports, especially if you are experiencing that violence or abuse from somebody who is, particularly if they're paid to support you, or an organisation is providing that. There are issues about not being believed or not being seen as a credible witness. The Commission wants to hear about what will make the justice system more accessible to people with disability following violence and abuse in the home. Gaps in safeguards, community visitors and other independent assessments. Wherever you've got experience, please get that into the Disability Royal Commission. Again, there's a list of questions. I'm not going to go into them, but remember that the commissioners don't have the experience that you do, and they really need your voice in order to inform them. If you belong to one of the particular groups or a number of the different groups, then it's important to give your opinion, because it might be that combination which is of particular challenge. Again, promising practice, examples of co-design models or creating communities of practice and where that's beneficial to making people safer, to better equipping people so that they can speak out, and to having the political impact so that things are responded to in an appropriate way. The last two ones I'm just going to focus on. How are things different with COVID? If you've been in the bushfires or other emergencies, how has that impacted your risk of experiencing violence and abuse, and also the kind of response that you get from support services or from legal services around those issues? Again, question 13, have we missed anything? Anything that's not covered there which you think should have been covered there, the Commission is interested in hearing about. This paper, they want responses by the 26th of February. Responses will also be accepted after this date. Okay. The Promoting Inclusion paper, another big, huge paper. The advantage of not covering it today means that we can cover it some other time. Just to close off this formal part, the links that can be helpful to you: the Disability Royal Commission's website, their helpline, Your Story Disability Legal Support. If you have any legal questions about approaching, starting to write something, about what you've written, about what to say, about what not to say, about whether to name a name or not, they're a great service to talk to. The number is there. Blue Knot Counselling for any kind of emotional support, and then the advocacy support that you can find with me at Family Advocacy or with another local advocacy organisation. What I do with people, I listen. I'm here to talk through your options. Is this a submission? Is this a response to an issues paper? I can't find the issues paper. How do I do this? I'm very happy to give feedback on what you've drafted, whether that's a recording or something written. And I've also helped people with editing a written submission. Just in summary, whether it's a submission or a response to an issues paper, your opinion has been asked for. And your story is powerful. You speak from experience. You can tell your story in whatever way works for you. You can send multiple submissions to the Royal Commission, and it doesn't need to be long. You can answer one question, one topic, one paragraph, one 10-minute phone call, or you can go into detail and explain exactly why it is. And you can add as many different attachments to either your submission or to your response to an issues paper as you feel is necessary. Thanks for listening. I know it's been long and it's intense. We'll have a question time, and we have a feedback form which we will send to you, and there's a link in the chat. Okay. All right. So we've got a little bit more time left. Does anybody have a burning question, or was there any questions that came up in the chat?
No, no questions in the chat, Troy. Thank you. But if anyone does have some questions they would rather put in the chat, that we can certainly try and respond to those immediately. Or you can unmute and ask away if you feel comfortable.
My contact details, yes. Oh, hold on. I'll just share that screen again. So these were the links again for people. Feel free to email me any questions that you have or give me a call. I work part-time in this role, so I'm generally available Tuesdays and Thursdays, and I also work half day on Monday. As I say, we do want to talk about the promote the inclusion issues paper, but we just felt we ran out of time today, so we will have another webinar coming soon where we can talk more about that. The other thing, if you'd like to talk in a group, we can organize a Zoom call where people can have a discussion together, and that way you're bouncing off lots of different ideas. But if you'd like that, please include that in your feedback form.